Hello, everyone. This is Dr. Amigues, your friendly rheumatologist and host of the Unabridged MD podcast. It is a pleasure to see you or to know that you are listening to the podcast this week. We have a treat today. We have Dr. Chetty, who is a chiropractic physician. So she's a doctor in chiropractic medicine. We're going to learn what chiropractic medicine is. We're going to learn what it does for our body. And this is going to be some really interesting podcast episodes. So please come and join us and listening. Dr. Chetty, thank you so much for being here. I think I'm going to ask the question that probably quite a bit of people are asking themselves. What is chiropractic care? And then the second question I'd have for you is, how did you end up a chiropractic physician?
Mm-hmm. Thank you for having me. I appreciate you having me over here. So chiropractic is really the medicine where we're healing the spine and the body. And so we're really treating and looking at how the spine is functioning. We're looking at if there's spinal dysfunction, and if the spine is moving appropriately, and also if there's, muscle tightness and a kind of a joint dysfunction there. And chiropractic is not only about just spinal health and joint pain. So chiropractic also affects digestion, it affects your mood, it helps to de-stress. So it has a lot of similar functions as, massage and acupuncture and all those as well. And so for me, I am maybe 50% chiropractic now and 50% functional medicine in my practice. And so I started, I actually went to chiropractic college after working for a chiropractor for a year, after I had my biology degree, and really saw how chiropractic impacted people's lives and how many options it gave, the practitioner in terms of, things that I wanted to practice. And so I decided to go to chiropractic college, and now I've been practicing for almost 16 years, and added functional medicine in the past few years specifically. So a typical things that we would treat in the office would be helping people with their gut health, helping to balance hormones, heavy metal detox, mold detox, optimizing blood health. So, blood work. So yeah, we do quite a few things.
Okay, that's wonderful. I want to hear more about the chiropractic care, because it's definitely not something that we learn in medicine, like in our Western medicine. And you said that, yeah, it's the management of the spine. And that's, I think, what we are all thinking is like, oh, it's the spine. So talk to us, why is it more than just the joint? Why is it more than just the spine? What's the I don't want to say belief, but what's the root? What's the root thought when it comes to chiropractic medicine?
Yeah, absolutely. So it's not only about the joints, because as we know, the skeleton, when it comes to the skeleton, there are nerve endings that are coming out of each segmental, level of the spine. And so when we are treating the spine, we are affecting that nerve function, and there's nerve roots that are going to all the different organ systems in the body. So when the actual adjusting helps the joints, but it also helps nerve flow and proper function to the body. So, after, you can see with patients, you adjust their low back and suddenly, they have better bowel movements, or they have better digestion, or, we're adjusting their neck and they feel better in terms of mood. So it does affect the other organ systems as well.
Okay. And when you say you're adjusting, what are you actually doing?
Yeah, so the adjustment process is, typically somebody will come in, a new patient will come in, we'll check their range of motion, do orthopedic tests, really check to see how the spine is moving and what the muscles feel like. So if they're really tight, or if they're spasmed, or if there's scar tissue there. And so most of the chiropractic portion is making sure that we free up any segmental dysfunctions there, helping the muscles relax in those areas so that there's better function, better range of motion, and helping the patient kind of get back to their pain-free state.
I love this. So there's like a couple of thoughts that I have as you were explaining this. The first is, and I think from a Western doctor, like Western medicine doctor, is to me, I'm really interested in this type of medicine that you're doing because it's taking the patient as a whole. It's this idea that it's not segmented. I think the Western medicine is extremely powerful. We have drugs that are better than ever, and it keeps getting better. And yet, I do feel that we are also dividing the body in specialty and subspecialty. And so the doctor, like the patient has to see this physician, this specialist, this specialist, this specialist. And it's really the idea of like, no, put it all together. Like this is a whole body issue. So when you're sharing this, I'm always thinking so this is interesting. We were one cell at one point. When we started, we were one cell, and then we were two cell, and then we were, 4, and etc. And we'd multiply. And then at one point we were a globus, and at one point, it's called the embryogenesis. We basically create the spine by opening, right? So the baby, it's actually fascinating. The baby just opens up, right? Like the fetus opens up. And so there are cells that were where the head is that are now, where the tail is. And the spine is this, like the cord. The spine is after to help the cord, to help protect the cord. The nervous system is one of the first thing that is being generated as the baby, as the fetus is being made. It is very funny because every time I'm like, I'm not spiritual. I'm like, there's no way I cannot be spiritual when I see how beautiful human bodies are. Like, I just can never not be spiritual because it's just incredible how well we're done. And so it is, to me, very interesting to think, the spine is the first thing, like one of the first things that's being done. Not the spine, but the nervous system, right? Is this how we teach chiropractor? Like, is this the concept of chiropractic medicine? Is that what this is from?
You're giving me flashbacks of embryology in chiropractic college here. So we had some pretty detailed embryology, classes about that. But yeah, we do learn quite a bit about, how the spine is formed and how it develops in utero, and the importance of, developing a proper curve. So allowing the baby to crawl first and then start to walk to develop that lumbar spine. So we do go through quite a bit of, learning when it comes to embryology and the formation of the spine.
Okay, fascinating. And then when the other question I had for you was, so first of all, it's so cool to talk with someone that's putting their hands on the patient. I put my hands on the patient, but not to fix them, which actually, I'll be honest, I think it's lacking. I wish my hands had healing power in a way, right? And your hands have healing power in that sense. And what I wonder is, can your hand, do you talk to the patient first and then figure out what's happening? Or do you directly or very soon go into, I'm going to listen to what the body has to say?
Yeah. So I think when I see a new patient, the history itself will tell me a little bit about what's going with them. But then, when we start the exam itself, I'll do a full exam before, I tell the patient what I feel like is going on at that point. But yeah, we have a pretty good idea after doing the exam, checking the spine, checking all the muscles, seeing the range of motion, and combining that with the information from the history itself to get a full picture of what's going on with the patient. So yeah, it's a little bit of a combination of both the history and physical to kind of figure it out.
Got it. And so I'm assuming the people don't come to you just with back pain.
No. So, There's shoulder pain, neck pain. Those are pretty common. Any joint, really. It's like, people who run have ankle issues and knee issues, hip issues. And then also there's, the functional medicine portion as well. So.
Of course, yeah. And sorry, we've had some functional doctors on the podcast, so that's why I think, and we've never had a chiropractor. So
okay, great.
I'm really like focusing on the chiropractor part here because we've never had the opportunity to talk with someone. And so another question regarding chiropractic care is, and I'm thinking of what I know, which is like acupuncture and things like that. So in acupuncture, some points of, the feet, of the foot are, they relate to something in the gut or something. Is that the same? Like, is that the same? So basically what I guess my question here is, it seems to me, and I have a comment too, it seems to me that we are segmentizing the bodies of our patients. And it seems to me that chiropractic care is about putting it back whole as this balanced ecosystem, right? And so what I wonder, because that fascinates me, is what in medicine we have called referred pain. So you may have pain in your belly, but really what's happening is, or you may have pain in your shoulder, but the shoulder is referring to your belly, or the shoulder is referring to your heart, right? That's all. And so that's why I can understand that. But when you're talking to an acupuncturist, they'll tell you, well, if you have pain here, it might be from this, and that has nothing to do with the first organ that's painful. Is that the same? Is that something that you see in chiropractic care?
Yeah. So in two ways. So especially when you look at specific muscles and referred pain. So, some person can have pain in their arm, but it's a muscle in their, upper back kind of referring into the arm. So we have specific referral patterns for muscles specifically. There's also, part of our, somebody will come in with jaw pain. And, a lot of it is coming from the upper neck or, the front of the muscles. So sometimes it's not only the area that they're complaining about, it's also, the general area that might be referring, or the upper neck is dysfunctional. So then it starts to impair the way that the jaw functions. And so therefore you have more jaw pain. So it's not always the one area, but it can be coming from other areas as well, for sure.
And if we had to, I'm assuming, if is this something that you have to do as one session or in a couple of sessions? How do you know if a patient is going to need 1, 2, 3 more sessions?
Typically, if the patient has an acute complaint, their low back has been hurting, and we want to make some good change, I typically need to see them more frequently at the beginning. And then as they start to feel better, we kind of spread out the visits. But, 4 to 6 visits at the beginning is pretty typical, just to really address that issue and make sure that we take care of it and it doesn't recur, right? So if those initial treatments are too far apart, it is harder to make progress. And so, at the beginning, treating more frequently, and then as the condition is managed, then we can spread it out and maintain.
Yeah, that's really cool. So I think the comments that I would have here is that, for those auditors that are listening to the podcast on a regular basis, we've had quite a bit of guests at this point of functional medicine, acupuncture, chiropractic, etc., and naturopathic care, Ayurvedic medicine. And what I would say is that what I really find fascinating in out of the care, out of those, non-Western, I think it is still Western. I don't know why we make this distinction, but that's understood, right? Western is medication and all this, and Eastern medicine is more to understand, to think that the body is just in balance, has lost its balance, and the goal is to get back the balance. But what's really, really nice to hear is to think, all of those modalities are basically saying the body has lost balance. And from whatever, we're basically using a specialty or another, like functional or acupuncture. I never had someone Qigong. I should probably interview someone with Qigong medicine, because that is fascinating as well. And it's really this idea that we're putting it back together, this idea that there is one organ or one joint or more than one joint, that a system that's not working, but the goal is to put back in balance the full body. And so I find that really, really interesting to think that someone may have an ankle pain. And if, maybe it's acute, maybe it's not acute, but the idea is like, we're going to rebalance that so we can get out of it. Now, a question I have for you, and I do not know if you have an answer, but I'm really much of the idea that our body keeps the score. It's actually not a book. The book is great, but I couldn't finish it because it was a little too violent for me. The stories were really too violent. And what I wonder is, if you agree with that, are we seeing in chiropractic care, are we seeing patients that basically and it just keeps piling up, and then one day they have an ankle pain, and basically this ankle pain is just the window that's opening up the whole issue that's in the back, and it's then up to the patient and the practitioner to care about that or not. What do you think?
Yeah, I think that's quite that definitely happens because people, accumulate all this stress and they will hold it in specific parts of their bodies. And, the more stress and anxiety that they're exposed to, the worse the condition gets. And so sometimes we can treat that area and do all the things and it makes it better, but it doesn't get to 100% of where it needs to be until they kind of address the source of anxiety, stress, all those different things, so that that condition can improve to 100% or, get better. And so, you also find, you work on a specific area of somebody's body and all these emotions come out, because all of that stress and anxiety has been held in that part of the body. And so I definitely see that. Yeah.
Yeah, I love that. And so we're coming towards the end of our podcast recording. And one of the questions I love asking my guest is to share a history of hope. Do you have a history of hope, or maybe more than one history of hope with a client/patient where, can you share a story with us?
Yeah, I'll share a story. I have a lady that came to see me with shoulder pain. She enjoyed playing pickleball, but wasn't able to play pickleball because of her shoulder pain. And so she came in barely able to kind of lift the arm and move the arm appropriately. And we did a lot of work on her shoulder. We did, a combination of therapies in office, including, shockwave therapy and cupping and dry needling and muscle work and adjusting. And she was able to get better, within faster than I thought she would. It did take some time, but the joy of getting somebody back to something that brings them joy, right? So getting back to pickleball, getting back to, holding and lifting the grandchildren, all those different things that make people happy. That's always the true joy of the job, really.
I love it. I agree. I fully agree with you. And I think that makes me want to say this, which is that there is no reason for our patients, for anyone listening right now, to be okay with pain. I think that there's always a new approach that you may not have tried. And I think if you have seen already orthopedics, if you've seen rheumatologists, if you've seen, try again. Like if it's more than one joint, I would say come and see a rheumatologist, because we need to figure out what it is. And just as plug in, by the way, if you're looking in Colorado, I'm still accepting new patients. So it would be an honor to see you. And if you still have pain and you're like, well, try other stuff. If you haven't tried chiropractic care, try acupuncture, try energy healing for what it's worth. And personally, I'm a big fan of it. I don't understand it, but I'm still a big fan of it. Try what doesn't hurt you, what makes you feel better, and be curious about other modalities. I think we don't know all the modalities, and I would say that I'm always thinking of my grandma in Corsica, so for friends, and she would do prayers. She would put olive oil on us and do prayers, and then the next day you were totally fine. The power of placebo, right? But that's fine. It did make me feel better when I was a kid. So I love that. And so you can actually ask one of your grandma to do that for you too. But yeah, I think that's really important is don't be okay with pain. We can take care of it, because the issue with pain is as it becomes chronic, you can actually develop anger, and this anger is going to turn against you because it's going to go towards the people you love, and it's going to go towards you, and there's no reason. You do not have to live in pain. So, well, I guess, Dr. Chetty, where can we find you? Where do you practice, so that if anyone is dealing with that, they can come and see you?
Yeah, so we have 2 practice locations. We have one in Longmont and one in Lakeside, Denver. We are alternative family medicine and chiropractic, and you can find us at altfammed, which is altfammed.com. And we would love to treat you and help you in your in getting better. So,
yeah, perfect. Another reason to visit Colorado if you're outside of Colorado. Yeah. So, Dr. Chetty, thank you so much for being here. Everyone, check out Dr. Chetty's website. And if you are in Colorado, or if you're coming and visiting Colorado, because it's a beautiful destination for vacation, either in the winter or in the summer, come and check out Dr. Chetty's practice. And then if you're looking for a rheumatologist, I'll be happy to see you. And then until then, we will see you next week. And it's been a pleasure. And if you want to share this episode with someone, we would really appreciate it. Have a wonderful week, everyone. Take care.